According to the Millennium Development Goals, also known as MDGs, which is a set of 8 international development goals set by the United Nations back in the year 2000, access to affordable healthcare is critical. But as the 2015 target deadline on achievement of this goal closes in, many Kenyans still cannot access quality and affordable healthcare services.
We have a very mixed picture in East Africa when it comes to MDGs. 3 of the 8 MDGs, as you know, are related to healthcare. In some of the MDGs, we've made significant progress, while in the others, we're actually reversing the progress. One such concern that we have is maternal mortality. If you look at the statistics of maternal mortality, we've been reversing the gains. And this probably is contributed to several factors, such as geographical and financial barriers that exist in East Africa.
Key concerns hindering achievement of universal healthcare include inadequate hospital facilities and affordable services. Healthcare providers feel that public and private partnerships, commonly known as PPPs, are critical to helping address these concerns.
PPP has become an important subject, and out of the 5 East African countries, Kenya is the first one to enact a law of PPP. Having a PPP Act in the government of Kenya provides a framework on how the private and public sector can interact. Previously, it used to be a cozy relationship, either in providing services or goods to the government. But through a structured act, we will have nodal focuses and PPP units in the governments that will create a solid partnership between public and private.
There are a lot of Kenyans going to India. There are a lot of Africans passing Nairobi to India. And how can we keep Kenyans here? How can we keep Africans here? But for you to do that, the private sector must come in perhaps providing the infrastructure. If people are going to stay here, they must eat. So who is going to provide the food? They must sleep. Who is going to provide the hotel? If you go to India, most of the houses are benefiting from that.
Experts say growing the health sector will have a positive effect on Kenya's economy, but they urge the government to take the lead.
If you go particularly to the health sector, the private sector is here looking for, if I import certain equipment, can I get tax rebate or holidays? If I import certain things, training, can I get some rebates? And that's not the real thing. Because what that does, it translates to more taxation of the common person. What perhaps we should be looking from the private sector, yes, I want to do my business in the health sector, but do I have energy? Do I have the infrastructure, the loads? Do I have the ambulances? Do I have roads if there is a patient to be taken to the airport, to the nearest health facility? There's that infrastructure. I think to me that is more sustainable.
The key points of this strategy is to keep Kenyans in Kenya, to bring the world-class quality services right at the doorstep. And what do we need to do? The only reason we see so many patients going to India or South Africa and UK are related to quality and cost. So we need to make sure that the centers of excellence have the right kind of equipment and the right kind of skill, and we increase the number of our health workers so the supply side increases to meet the demand side, and that's how the cost comes down.
Affordable insurance is also key. Without that, most people will not have access to quality care.
How do we have a health insurance or a health cover that will let citizens access care? These complex issues are being discussed. We are trying to find solutions that will have a mix of a tax-funded system where the government provides better quality services for its citizens, together with a robust private sector initiative for affordable covers and affordable plans.
Marketing of health insurance has been very wanting in this country. Very few people talk about health insurance. So we need a robust marketing system. We need a robust talk on health insurances.
Kenya is working hard to industrialize and create a middle-income economy by the year 2030. Investment in a healthy workforce is key to making that effort a success.
We think that improving health is not an event of 2015. It is a process. So whether we achieve better health indicators in 16, 17, 18, will continuously try to improve the environment and policies and partnership to have better healthcare for East Africa.